Hey, this is Lisa. I know you're getting ready to start your next session of Select Connects with Clinicians, but first, I think we should do a quick warm-up and review key points from the previous session. In the previous session, we reviewed the Home Health Conditions of Participation, Chapter 7 of the CMS Benefits Manual, and the OASIS Conventions. From the Conditions of Participation, we learn patients and their representatives should receive written and verbal explanations of their patients' rights. Patients have a right to safety and to have their property protected. Patients also can refuse treatment before treatment is begun and or as treatment is being given. Patients also have the right to make complaints and to have their complaints investigated. The plan of care must include the patient's strengths, goals, and preferences. The comprehensive plan of care must align with physician orders. From Chapter 7 of the CMS Benefits Manual, we learned that a home health patient receiving services that are being paid for by Medicare must be considered confined to home, or also known as homebound. To meet this definition of homebound, 3 conditions must be met. From criteria 1, one of these conditions must be met first. Either the patient is confined to home, which means that they need the aid or supportive devices to leave home safely, or leaving home is contraindicated. So they must meet one of those criteria. And if at least one of those elements apply to the patient, to be considered homebound, he, she, or they must meet both parts of criteria 2. So, criteria 2 is the patient in question has a normal inability to leave home, and leaving home requires a taxing effort. So they must meet at least 3 of those conditions. Finally, we want to touch on a couple concepts from the OASIS Conventions. First, for each OASIS item, you must know the time period under consideration. So, unless there is guidance that states differently, you will apply the principle of the day of assessment. The day of assessment is the time of the visit by the clinician completing the OASIS assessment, plus the 24 hours immediately before the clinician's visit. Next, if a patient's ability fluctuates throughout the day, you want the OASIS item responses to reflect what is the patient's usual status. Now that means you want the OASIS item to reflect what is true for the patient more than 50% of the time. Finally, you may use collaboration with other medical caregivers to complete the OASIS items unless guidance or agency policy states otherwise. If you do use collaboration, make sure that your MOO90 date reflects the appropriate date for when the OASIS assessment was completed. Okay, everybody, that's it for our warm-up. Enjoy today's session.
Welcome everyone to the second session of Select Data's OASIS training. My name is Deborah Johnston and I am your host today. Material during the series will be delivered by members of the Select Data Clinical Leadership Team. Before getting started, I'd like to remind you of our disclaimer. Information made available from this webinar should not be considered legal advice. It is for educational purposes only and does not provide all available information on the subject. Information shared is not a promise or warranty, guarantee, expressed or implied. The opinions expressed, discussions undertaken, and materials provided do not represent an official position of Select Data. This module reviews items related to patient tracking. These OASIS items include information collected from M0010 and M0069.
M10, intent, time points, and data sources. M10, item intent, specifies the agency's Center for Medicare and Medicaid Services, CMS, certification number, CCN/Medicare provider number. Time points, item is completed, is at start of care on the patient tracking sheet. Data sources or resources, agency administrator and billing staff. M10, CMS certification number. Response-specific instructions. Enter the agency's CMS certification or Medicare provider number if applicable. If agency is not Medicare certified, leave blank. This is not the provider's NPI number. Pre-printing this number on clinical documentation is allowed and recommended. M14, intent, time points, and data sources. M14, item intent, specifies the state where the agency branch office is located. Time points, it is completed, is at start of care on the patient tracking sheet and updated if change occurs during the episode. Data sources and resources, agency or branch administrator. M14, branch state. Response-specific instructions. Enter the 2-letter postal service abbreviation of the state in which the branch office is located. If a branch ID, not N or P, is entered in M16, then M14 cannot be blank. Pre-printing this abbreviation on clinical documentation is allowed and recommended. M16, intent, time points, and data sources. M16, item intent, specifies the branch identification code as assigned by CMS. The identifier consists of 10 digits, the state code as the first 2 digits, followed by an uppercase Q, followed by the last 4 digits of the current Medicare provider number, ending with the 3-digit CMS assigned branch number. Time points, item is completed, is at start of care on the patient tracking sheet and updated if change occurs during the episode. Data sources and resources, agency or branch administrator. M16, branch ID number, response-specific instructions. Enter the federal branch identification number specified for this branch as assigned by CMS. If you are a home health agency with no branches, enter N followed by 9 blank boxes. If you are a parent home health agency that has branches, enter P followed by 9 blank boxes. Pre-printing this number on clinical documentation is allowed and recommended. M18, intent, time points, and data sources. M18, item intent, identifies the physician who will sign the plan of care. Time point, item is completed, is at start of care on the patient tracking sheet. Data sources and resources. Agency Medical Records Department. For more information, see the link for NPI registry in Chapter 5 of this manual. M18, National Provider Identifier, or NPI, for the attending physician who has signed the plan of care. Response-specific instructions. The NPI is a 10-digit numeric identifier. M20, intent, time points, and data sources. M20, item intent, identifies the agency-specific patient identifier. This is the identification code the agency assigns to the patient and uses for record-keeping purposes for this episode of care. The patient ID number may stay the same from one admission to the next or may change with each subsequent admission dependent on agency policy. However, it should remain constant throughout a single episode of care, for example, from admission to discharge. Time points item is completed is at start of care on the patient tracking sheet. Data sources and resources, agency, medical records department. M20 patient ID number. Response-specific instructions. If there are fewer digits than boxes provided, leave boxes at the end blank. M30 intent, time points, and data sources. M30 item intent specifies the start of care date, which is the date that the first reimbursable service is delivered. Time points item is completed, start of care on the patient tracking sheet. Data sources and resources, agency administrative staff. For skilled physical therapy or speech therapy to perform the start of care visit for a Medicare patient, the home health agency is expected to have orders from the patient's physician indicating the need for physical therapy or speech therapy prior to the initial assessment visit. If no orders are present for nursing at the start of care, a reimbursable service must be provided, and the need for this service establishes program eligibility for the Medicare home health benefit. Accuracy of this date is essential. Many other aspects of data collection are based on this date. When the agency's policy or practice is for a registered nurse to perform the start of care assessment in a therapy-only case, the nursing assessment visit must be made the same day or within 5 days after the therapist's first visit. If questions exist as to the start of care date, clarify the exact date with agency administrative personnel. M32, intent, time points, and data sources. M32 item intent specifies the date of the first visit following an inpatient stay by a patient receiving services from the home health agency. Time points item is collected is resumption of care. The resumption of care date must be updated on the patient tracking sheet each time a patient returns to service following an inpatient facility stay. Data sources and resources, agency administrative staff. M32, resumption of care date. Response-specific instructions. At start of care, mark this item as NA. The most recent resumption of care date should be entered. If the date or the month is only one digit, that digit is preceded by a 0. For example, May 4th, 2019 would be 05/04/2019. Enter all 4 digits of the year. Assessment strategies. If question exists as to the resumption of care date, clarify with the agency administrative staff.
M0040 item intent specifies the full name of the patient, first name, middle initial, last name, and suffix. For example, junior, the third, etc. The time point for completion of this item is at the start of care and should be updated if any changes occur during the episode. The data sources for this item include the patient's Medicare card, private insurance card, HMO identification card, etc. The response-specific instructions for M0040. Enter all letters of the first and last names, the middle initial, and the abbreviated suffix. Correct spelling is very important. If no suffix, leave blank. If middle initial is not known, leave blank. The name entered should be exactly as it appears on the patient's Medicare or other insurance card. The name entered should be the patient's legal name, even if the patient consistently uses a nickname. The sequence of the names may be reordered, that is, last name, first name, etc., in agency forms if desired. M0050 item intent specifies the state in which the patient is currently residing while receiving home care. The time point for completion is at the start of care and should be updated if any changes occur during the episode. The data sources for this item include to clarify the exact state location of the residence with municipal, county, or state officials if necessary. The response-specific instructions for M0050. Enter the two-letter Postal Service abbreviation of the state in which the patient is currently residing, even if this is not the patient's usual or legal residence. M0060 item intent. This specifies the zip code for the address at which the patient is currently residing while receiving home care. The time point for completion is at the start of care and should be updated if any changes occur during the episode. The data sources for this item, you should verify the zip code with the local post office if necessary. The response-specific instructions for M0060. Enter the zip code for the address of the patient's current residence, even if this is not the patient's usual or legal residence. Enter at least 5 digits, 9 digits if known. The patient's zip code is used for Home Health Compare to determine places where your agency provided services. Be sure to use the zip code where the service is provided. M0063 item intent. This is for Medicare patients only. It specifies the patient's Medicare number, including any prefixes or suffixes. Use the RRB number for Railroad Retirement Program. The time point for completion is the start of care and is updated if any changes occur during the episode. The data sources for this item include the patient's Medicare card. Referral information may also include the number, but it should always be verified with the patient. The response-specific instructions for M0063. In an effort to fight identity theft for Medicare beneficiaries, CMS is replacing the Social Security number-based Health Insurance Claim Number, HICN, with a new Medicare Beneficiary Identifier, the MBI. Prior to April 1st, 2018, enter the HICN, identified as the Medicare claim number on the patient's Medicare card. Please note, this may or may not be the patient's Social Security number. April 1st, 2018 through December 31st, 2019, enter either the patient's HICN or the patient's new MBI. After December 31st, 2019, enter the MBI. Do not report the patient's Social Security number-based HICN. If the patient does not have Medicare, mark NA, no Medicare. If the patient is a member of a Medicare HMO, another Medicare Advantage plan, or Medicare Part C, enter the Medicare number if available. If not available, mark NA, no Medicare. Do not enter the HMO identification number. Enter the Medicare number if known, whether or not Medicare is the primary payment source for this episode of care. If there are fewer digits than boxes provided, please leave the boxes at the end blank. M0064 item intent. This specifies the patient's Social Security number. The time point for completion is at the start of care. The data sources for this item include the patient's Social Security card, if available. The referral information may include the number, but it should still be verified with the patient. The response-specific instructions for M0064 include all 9 numbers, mark UK if unknown or not available. For example, information cannot be obtained or patient refuses to provide the information. M0065 item intent specifies the patient's Medicaid number. The time point for completion is the start of care and should be updated if any changes occur during the episode. The data sources for this item: patient's Medicaid card or other verifying documentation. Make sure that the coverage is still in effect, such as checking the expiration date. Depending on specific state regulations or procedures, you may need to verify coverage and effective dates with the Social Services Agency. Referral information may include the number, but it should be verified with the patient. The response-specific instructions for M0065 include all digits and letters. If the patient does not have Medicaid coverage or Medicaid coverage is pending, mark NA for no Medicaid. If the patient has Medicaid, answer this item whether or not Medicaid is the payer source for the home health care episode. This number is assigned by an individual state and is found on the patient's Medicaid card. M0066 item intent specifies the birth date of the patient, including the month, the day, and the 4 digits for the year. The time point for completion of this item is at the start of care. The data sources include patient or caregiver report, other legal documents, for example, driver's license, state-issued ID card, etc. The response-specific instructions for M0066. If the date or month is only 1 digit, that digit is preceded by a 0. For example, May 4th, 2019 would be entered as 05/04/2019. Enter all 4 digits for the year. M0069 item intent specifies the gender of the patient. The time point for completion is at the start of care. The data sources include the patient caregiver interview. If the patient does not self-identify, referral information including hospital or physician office clinical record data can be used, or observation. Physical assessment can also be used. The response-specific instructions for M0069. Enter the response for the patient's gender, male or female.
This concludes Session 2 of Select Data's OASIS Clinical Education. Special thanks to Select Data team members Tisha Smith and Stephanie Kahn for delivering this material. To reinforce what you've heard today, you are advised to refer to the session notes that will be provided for you from Clinical Services. For further reading and clarification of this material, the session notes also contains links to the OASIS Guidance Manual, Chapter 7 of the Medicare Benefit Policy Manual, and the CMS Conditions of Participation for Home Health. All of these resources are available on the CMS website. Do you have questions about this presentation? Please contact us via email at clinical.services@selectdatacoding.com. Learn more about how Select Data can help your agency with compliance and better patient outcomes. Visit us on our website or follow us on social media. Join us for our next session, which will review the clinical records, living arrangements, and sensory domains. My name is Deborah Johnston, and I am the Director of Clinical Services for Select Data. I look forward to spending time with you during our next session.